So now we have with us our Associate Deans, Dr. Francis sir and Sushit sir with us. We will quickly have a formal inaugural ceremony, and after that we will continue with the other two lectures and panel discussion. So I request the chief guests, Francis sir and Sushit sir, to come on to the dais. Also request K Nair sir and Sarath sir to be on the podium. Please be seated. Thank you. First, Rajiv, as already mentioned, today Rajiv Gandhi University and JeevaRaksha Trust, in association with AJ Institute of Medical Sciences, Mangalore, has organized this CMA program on simulation in medical education for all the ECLS, ENLS, and BCLS providers, instructors, and course coordinators. So, as a formal inaugural ceremony, we have with us Dr. Francis Pereira, sir, Francis Moderator, sir, as a chief guest today. He's an associate dean of our AJ Institute of Medical Sciences. So, he has agreed to be with us as a chief guest. Thank you, sir, for being with us. We also have our associate dean, Dr. Sushit, sir, with us. He's the head of the Department of Biochemistry at the AJ Institute of Medical Sciences. Thank you, sir, for being with us. We have our CEO of JeevaRaksha Trust, Dr. K Nair, sir. Welcome to you, sir. Also, Chief Coordinator of AJ Skills and Simulation Center, Dr. Sarath, is with us. Thank you for being with us. I would like to request Dr. Francis, sir, speak a few words.
Professor Dr. Ram, Dr. Sushit, Dr. Sarath, and all those who gathered here. So I am pleased to be part of this update regarding the JeevaRaksha program, and it's indeed a nice thing to know that they are updating themselves and doing reflection what they've done all these years and trying to improve upon the things. And in our college, it is the team led by Shetty and Dr. Ryan, who are doing exemplary job, and it is shown that the results are shown in the training they are conducted and the feedback which is given by the students. I wish them all the best and hope that this will indeed create graduates of global standard. All the best and thank you.
Now I request Dr. Sushit, sir, to say a few words.
Good afternoon, everyone. Professor Ram sir, Francis sir, and distinguished guests from all the neighboring colleges. Simulation has been something that I was at least introduced to back in 2012 when I went to the Calicut Medical College for a medical education workshop. And when the principal there came and told that one aspect of medical education which will change a lot in the next decade will probably be in the skill and simulation training. And there we are 10 years down the line. I think this has become probably the centerpiece of medical education today. And without proper skill and simulation, no medical graduation probably will be complete. And in that regard, probably JeevaRaksha has worked as a wonderful programs who have been training now 5-6 batches of interns here, and it's a great learning experience for even the other courses like the allied physiotherapy, nursing, and I hope this tradition continues with whatever updates we are getting it time and time again. So that would be a great opportunity. Have a great time. Welcome to AJ. Thank you.
We have had so many ECLS training programs in our college and other centers as well. As a representatives, I would like to request two of the recently who have trained by these ECLS courses, Dr. Amar and also Dr. Sarath, to share their experiences. Dr. Amar first.
Good afternoon, everyone. I'm Dr. Amar, post-graduation in general surgery. I took up the case of ECLS, that is emergency care and life support, a few months ago. It was a very helpful teaching experience for all of us. Like, usually we are very underconfident as an undergrad, reading only the theory and not applying much into the practical aspect of emergency care. But in this course, in our college, it was a very helpful experience for all of us. I really like the teaching module, which consists of the theory firstly, secondly the demonstration, thirdly the practice, and then the debriefing, which consists of what's good and how we could improve what can be made better. In an emergency situation, firstly, we recognize the critical illness, then how to stabilize the resuscitation and refer to the safe center. It gives us a better idea in how to handle the emergency situation rather than running away from it. The objectives mainly consist of cardiac, respiratory, neurological, obstetric, neurological emergencies and emergency trauma care. So I would like to tell everyone that as a postgraduate now, the interns posted under me, or the UGs, that this is a very helpful course which would help them to get a better idea and take care of the patients and give a better medical facility and care. The staff in our AJIMS Innovation Center are really beautiful, really helpful, and they gave us a beautiful answer. Really helpful and beautiful, and they gave us a lot of knowledge regarding the ECLS care. Thank you, everyone.
As an internship in AJ Institute of Medical Sciences.
Good afternoon to one and all present here. I have nothing much to say. I have already told all the advantages of ECLS classes, but mainly I want to tell us about our instructors. When Sarath sir told me how was the experience in ECLS class, the only thing came to my mind was our instructors. They were so helpful, immense support from their side. I remember the classes were so interactive. When they understood that we were getting bored, we used to have games, and also the only advice I would give the new interns who are going to these ECLS classes, take utmost use of it. Like, if you have any doubt, interact with them. They are ready to help you guys. So be there. That's it. And one more thing, that when I had my ECLS class, I had to give the vote of thanks. So I just told one phrase, that is that 4.5 years of my MBBS course was actually that it was so useful. It was made useful only because I had that 4 days of ECLS class. So
now I request our CEO sir to give a token of gratitude to the chief guest. I request Sushit sir and Francis sir to give a token of gratitude and appreciation to our previous speakers, Dr. Sudheer, Prabhu sir and K Nair sir. We also like to know the presence of senior instructors and the course directors from different organizations, like Gayatri madam is there with us, and our own AJ's Aswathy madam is there, and from KVG we have representatives, and from GMC from Kshema, and so many other senior instructors. Sudheer sir is there, so we would like to acknowledge their presence as well, and so many staff have come from AJ Allied Sciences, and so hope we are getting a very good overview and also of this JeevaRaksha courses and how it's helping in saving immense lives, and hope this continues with all your support and blessings. Thank you so much, sir, for being with us for valuable time. We really appreciate that.
Okay, good afternoon, everyone. Dr. Nair, all the AJ instructors, I think faculty from AJ, Fathomless, KVG, and most important, Shema, okay. Most importantly, sorry?
Seattle is also.
Sorry?
Seattle is also.
Seattle, yes. Yeah, how can I actually missed her when I entered, okay. I thought actually today was like Muh Dikhai of Kishan. So we have Dr. Kishan Rao, who's the zonal manager for Mangalore for all JeevaRaksha programs. And we thought of having this simulation and medical education program mainly so that all the instructors in Mangalore, ECLS, ENLS, know him, and also we have a small informal get together. And at the same time, we were also discussing about the way we are rolling out ECLS courses in our institution. So quickly, I'll not take more time. I would share what exactly worked for us throughout this COVID pandemic, and what we are going to continue with our working model of the ECLS training. No problem. Okay, so I'll be going through the following contents: the felt need, what are the hybrid models, quick stakeholder feedbacks, and quick outcomes. I've specifically mentioned the outcomes because I don't have much data to term it as impact. Okay, nothing to disclose, no financial interest or need. So this is something which all of us who have gone through the ECLS courses, we know about ECLS TOT program. This was the first TOT in 2018 when we did it in Davangere SS Institute of Medical Sciences. So it was a 5-day program. Now we have a day 0 also. And the intern rollout, except day 5, which doesn't include the TOT, is a 4-day program, and it's a continuous intense boot camp session. This is how we know the intern rollout to be. Day 1 to day 4, where there is a mixture of theory, skills, scenarios, and the last day, it's for the evaluation, which includes evaluation for theory as well as the skills. Okay. So what were the constraints for us for the rollout? During 2020, when we just finished for one batch, there was COVID-19. Apart from COVID-19, I specifically say it's a constraint rather than a barrier, because we are able to overcome it, and there were a few sound minds with definitely help from JeevaRaksha Trust. We were able to run the rollout courses with some modifications at our institution with the following perceived need. First of all, we had a government ordinance which said workshops or any training programs cannot be held, and if at all, it shouldn't be more than, initially it was 50, then they brought it down to 25. The rules kept on changing, COVID appropriate behavior, 2-meter distance, which was not feasible, not possible in our institution. And second, the environment also. Simulated our skill center where we used to conduct the training was a centralized air condition, and invariably we had prior experiences with a few MEU workshops where we got few clusters of COVID cases. Okay, so but still we wanted to continue the show, not just because it was an RGUHS norm. The institution also saw the changes. Now that was the biggest victory for the institutional ECLS team, because their administration saw ECLS as a working model which was actually helpful for the interns who are going for the peripheral postings. Okay, as in when we go further, we will be seeing again, the institution has made a norm that before the interns are posted to community medicine postings, they have to mandatorily finish the ECLS course, only then they'll be deputed to community medicine internship for the 12 weeks. Okay, so that was the second thing, which was again a victory for us. Apart from this, we had human resource crunch because interns were a very valuable resource. Be it fever clinics or containment zone, testing, outreach testing, everywhere the interns were supposed to be, the roster was made. So we couldn't bring them out for 4 days. So bringing them out for 4 days was very difficult at the time. The same problem was for ECLS faculty. Most of the faculty were young faculties. So obviously there were COVID duties. So it was again becoming difficult to relieve them. And slowly over a period of time, there was faculty attrition. What we started with 16, now we are left with 8. Till we finished the recent step 1 and step 2, we have additional 24. The stakeholder expectations from our team and mainly our vision of the Muller's ECLS team was the 3 R's which should be delivered to interns who will become the future Indian medical graduates.
Emergency. So JeevaRaksha app, all the work was done during that time. We also conducted our first international conference. Unfortunately, because of COVID, it was all online. But that happened. People were attending, even from WHO. We had Dr. Soumya Swaminathan attending. People who went to the front line from Kerala to Bombay and looked after the slum patients, people who had real hands-on experience with COVID. Dr. Sachidanand, the then Vice Chancellor of Rajiv Gandhi University, one of the most active academic institutions during COVID time. The number of CMEs, the number of programs, the number of booklets, the amount of evidence they collated and put out, tremendous amount of work Rajiv Gandhi University did at that time. So people representing the university were there. So we had a good combination of people from all around the world who were working hard at containing this pandemic, treating the patients who were suffering from it, all came together and gave us gyan, wisdom, experience, perspective, etc. After that, we were trying to fine-tune our program. So we came out with a post-COVID guideline, because as an organization, we have to be in touch with reality and we have to be flexible. Because what is the ultimate aim? Why are we all here? ECLS. No? Something beyond that. To save a life. Thank you so much. So the ultimate aim is a lot of people die unnecessarily in our country and similar income nations around the world, and the small steps we can take towards preventing reversible deaths. So towards that, when the situation changes, you can't teach anybody, you can't do hands-on training, how do you still save a life? So you have to be flexible. And from there came the post-COVID guidelines, where we suggested actually 3 models. Now, Father Muller's team are exceptional in their penchant for experimenting to try and improve things. Not just JeevaRaksha, they've done a lot of other work too. We just attended the country's first medical education skills conference. Last 2 days, many of us from here were at the conference. Fantastically organized, great amount of knowledge, great amount of perspective from leaders in the field across the globe was shared over the last 2 days. So along the same way, as pioneers in trying to do different things, trying to achieve perfection from different angles, they approached us asking, can we try something new? So we said, okay, we've got 3, please have a look. But the point here is, whatever we do, skills training on site has to happen. The ratio of 1:5 for the ECLS course, 1:8 for ENLS, BCLS has to be maintained. They did that in a tremendously courageous way and innovative way, and as you saw here, 5 different models. It worked out. It is not just 1 or 2 students' stories that we've had. We've actually had feedback from multiple interns, multiple final year nursing students from Father Muller's about how they managed this additional challenge of criticality with the pandemic and how lives were saved across the institution and primary health center, etc. We also heard from one intern from Shema who had completed his ECLS program and was on a flight going to US for his some sort of a placement. A call was put out in the flight saying somebody is looking really unwell, can we have a doctor please? Most of the qualified doctors looked really busy, because you bet in an India to US flight there will be at least 5 qualified doctors. Nobody came forward. As far as the air hostesses were concerned, there's only one guy who put his hand up, an intern. What is his name? We'll come to that. Of course, it has to be a Dr. Ram, right? So Dr. Ram Bhatt put his hand up, got up and went to see the patient. Now, it would have been much easier for Ram if that patient didn't have output and was not breathing. Many times an unconscious patient who doesn't breathe is an easier patient to manage, because the protocol kicks in, scene safety, output yes or no, consciousness yes or no, cardiac arrest, let's start, pump. Muscle memory. Unfortunately for Dr. Ram, this was somebody who was semi-conscious. Blood pressure was very low, dehydrated, a little bit of sepsis. So much more tough to manage than somebody who's unconscious and in cardiac arrest. Ram did all the right things. He put a leg up, he put a line in, gave fluid, gave some oxygen, and got the patient back to a more stable state so that they could take the patient to the right place and the patient's life was saved. United Airlines gave Dr. Ram Bhatt up and down ticket for the next trip to US. He was thrilled. He was thrilled more about the airline ticket guy. I'm just joking, but Ram did well, okay? And it's great to stand here and look at the camera and say Ram did well. Ram, if you're listening, you did really well. So we had any number of stories of lives being saved across the globe by JeevaRaksha. We had one orthopedic surgeon. I don't know whether Dr. Syed is logged in. He was in UK for a fellowship. This is an orthopedic doctor from Hassan who was in a developed country with all the facilities, with his children and family visiting a games park, one of these adventure parks, and a 3 or 4-year-old child fell from height, went into cardiac arrest. An Asian doctor with a slightly weird accent as far as they are concerned is trying to save a child in cardiac arrest. The local population objected first. His wife had to explain to them that this gentleman has had the training. It took the ambulance to get there 25 minutes. No matter how developed the nation is, no child would survive a cardiac arrest for 25 minutes without CPR. With all his heart, he sent a message back saying, I feel blessed that I could save this little child's life. When she came back alive, she looked like an angel. Thank you so much. What nobody knows is that we had a half an hour plus conversation, Dr. Vijayavaskar Reddy and myself, trying to convince this doctor who asked us a question. I'm an orthopedician. Why should I learn how to resuscitate a child, how to stop bleeding in a pregnant woman? Because my job is to operate on boards. The very same doctor sent us a message back saying, I feel blessed that I could save this little child's life. So where you train, who you train, and where that impact goes into eventually is anyone's guess. But at the end of the day, we are in a very fortunate position where our students are going around the world and saving lives. So JeevaRaksha as a name, it is making sense more and more because of the good work you all do. With that, I'm just going to run through a few slides quickly. For those of you who are uninitiated, there are a few organizations which are responsible for this program. So you can see Rajiv Gandhi University of Health Sciences, which most of you know about. First state university in the world, actually the first ever university in the world who came forward to, I've got this picture. It's okay. This one. Who came forward to support a life support program. So, you know, the AHA programs and others that you're aware of, they are all professional organizations. American College of Surgeons, American Heart Association, even in India we have Indian Resuscitation Council, Anesthetists of India, Pediatricians of India, different groups of professionals coming out with a program which is good. I'm not digging any of those programs in a positive or a negative way. They all pioneered and they showed us a way of life support, but none of them are accredited by an academic body like a university. So first time in the world, Rajiv Gandhi University realized there was a gap, realized that our students can't pay hundreds of thousands of rupees to get these foreign courses, and many a times the scenarios there don't translate to our on the ground situation. So they took the initiative with an organization called Swami Vivekananda Youth Movement, based out of Mysore, a social development organization which has been around since 1980s, and we got the technical help from University of Utah. So together they came out with the first program in 2014, and they haven't looked back. At that time they called the program JeevaRaksha project, and then eventually in 2019 a trust was registered, because beyond the borders of the state of Karnataka demand was increasing. We got called out to Goa, Assam contacted, Uttar Pradesh contacted, courses were done in Uzbekistan and Morocco by then, and everybody were asking for, we want this, because it makes sense in our low resource, high demand setting, and we also don't have lots of money to be paying for a course made for a different set of people in a different country. Okay, so that is how this whole organization came about. Oh, sorry, it's working. Right. So in 2013, they did a survey. These guys came around, and world's first course in emergency care was brought out for the interns in a PHC kind of setting. So the target was junior doctors in a PHC. But very soon afterwards, we realized that it is not just the doctors who need training. We all knew that, but once the program was rolling, our nurses came forward and said, what about us? Our dentists asked us, what about us? Do you have anything on oral pathology? Our question was, does it kill today, right now? If not, we don't. We only deal with emergency care. But they also got a program out of us. It is called a hospital emergencies and life support. They had asked for people who lost consciousness, people who lost airway, people who suffer from anaphylaxis. On a dental chair, suddenly life is gone. How will you manage? The answer to their query 3.5 years ago finally distilled out as a hospital emergency care life support, which is a two-day program, which is open for nurses working in critical care, in high dependency wards, in acute care wards, and emergency medicine, as well as doctors from all these areas and dentists. Okay, so that is a journey. So this is one of the first courses. That is Dr. Peter Talak, Professor Peter Talak from Utah, Dr. M.A. Balasubramania, Dr. Vijay Bhaskar Reddy, pioneers of the program. You can see Dr. Arunachala Ramesh and a few other seniors from the Bangalore region. The first set of candidates, but also the first set of contributors in fine-tuning the program. Dr. Sachidanand, Dr. Pushpa Sarkar, Dr. Shivanand Kapashi, the powerful trio of RGUHS in the COVID era really pushed this program forward. They were the ones responsible for registering a trust, making it mandatory for all institutions under RGUHS. It's only because of COVID that it has not been implemented forcefully, because we didn't want our students to run from pillar to post to get their certificates when they are already stressed out with COVID and limited education, etc., and facilities, etc. But now it is coming back as a mandated program, and if you don't do the appropriate program for your course, your degree certificate won't be awarded by the university. So we said the vision is saving lives and assuring a quality emergency care. Just be aware that there are 3 pillars. It is not just education and training we do. Research and development is also a key pillar of JeevaRaksha. We've been involved in some research in augmented and mixed reality with IIT Madras to come out with Indian scenarios of cardiac arrest. So you wear a virtual reality glass, you see somebody collapsed in Kodambakkam or Kabini, wearing a lungi or one of our traditional dresses with a pan shop or a masala dosa joint in the background. The sounds are familiar, the words are familiar. Currently, all the other available VR is the highway, the subway, New York, London, wherever. Okay, so trying to make it relevant for our population using technology. So that research is going on. We are also looking at, can we bring out products which are economically competitive to train hundreds of thousands of people. If you look at automated external defibrillator trainer, it used to cost about 8 to 10,000 rupees. Suddenly, overnight, price has gone from 10,000 to 42,000. Yesterday I heard another one is 96,000. All it has is a speaker, a little chipboard, and some recorded messages going on in a loop. Just for that, something as a technology which is only slightly advanced than our calling bell. The amount charged, because it's a medical training device, is huge. So discussions are on with appropriate agencies to try and see if we can locally make these products. And relief and rehabilitation, I was talking to you about pandemic support. We also do disaster management. And Dr. Gayatri and a large team of our trainers has been in Bhutan. Dr. Sarath was there, Jinsi was there. You know, and is there anybody else who went to Bhutan in this crowd? Bhatt is not here, no? Okay, so all of our trainers who went there did such an excellent job. They have invited us back to create a disaster management framework for the country of Bhutan. They are used to huge number of landslides, earthquakes and flooding. So that is where JeevaRaksha currently stands. So we are being requested by different parts of the globe to come and help out with their emergency care networks and other relevant facets of care. So currently what do we offer? You've all heard about ECLS. Keshan was trying to tell you, it is not just ECLS, there is emergency nursing and life support, there is basic emergency care and life support. So these are the three programs which RGUHS has made mandatory, these three. So the 4-day for the doctors, that 4-day for nurses, and this for everything else. Initially they put out a circular saying it's mandatory for allied health. So physio and pharmacy said, we are not allied. So the then Vice Chancellor said, Ram, can you please come out with an acronym which covers everybody? So we went PAHAD. Pharmacology, allied health, what else? AH is allied health, what else? D is for dentistry, A is for Ayush. Because many people just identified themselves as non-allied health. There's a lot of non-alliance going on. So he brought the whole mountain together and said, for all PAHAD guys, 1-day program is mandatory. Okay? And now, university has in principle has agreed to accredit these three programs. So these three programs didn't come from us. It was the hospitals and hospitalists who came forward and said, look, we need something, we don't have time 4 days to learn all these things. I am an obstetric specialist, I just want to deal with obstetric emergencies. None of my patients are of any other category. So from basic airway to advanced airway, basic cardiac resuscitation to medication and electricity-led advanced cardiac resuscitation is included in all three programs, plus their own corresponding conditions, PPH, eclampsia, puerperal sepsis in the obstetric emergencies, a distillation of ATLS, which is the best evidence-based course in the world for trauma. So a distillation of those principles and how to apply it in the Indian context, whether it is a tourniquet with a punchette or how to support a neck with a human being supporting the neck from pre-hospital environment to the hospital. Because many a times, if I say Philadelphia collar or a hard neck collar, people are running everywhere. Then they finally come with a little sponge with a Velcro. It is dangerous. You put that on, you think the patient's neck is protected, you don't support it any further, neck is going to go in all different directions when the ambulance flies through the humps. So, making it Indianized. Same thing I talked about hospital emergency care and life support. So these are all 2-day programs. Validity for all of them are still 5 years. Currently the price is 5,000, 3,000, 1,000, 2,000, 2,000, 2,000. That's the price at the moment. Now there is a discussion within the university saying that these are too cheap. And the institutions who are running it are not able to retain any sensible amount to service their equipment and pay their faculty, etc. So the prices could actually go up a little bit more. We are leaving it to RGUHS to come back to us. So we've covered this. This is comprehensive. It covers a lot of conditions. This is EMLS and ECLS are very comprehensive, and we have borrowed the communication module from ENLS, created by our nurses and international nurses and put it out to ECLS, because doctors who were teaching both were saying, why are you not teaching communication skills to our doctors? They needed more. So, communication skills. So, what I'm trying to say is we are not hierarchical. It's not like medical at the top and somebody else at the bottom. It is interspecialty, interdisciplinary, a very cooperative and combined model, challenging the traditional hierarchy, because those who know how to save a life should take the leadership in a resuscitation scenario. It shouldn't be based on, I am a professor of anesthesia, I've got 20 years of experience. But when a call goes out in an aeroplane, I put my head down between. Yeah, and some intern will run around trying to save a life. So what skills you have, what confidence you have should dictate who is a team leader in a life-saving situation. Okay, so we are quite proud of the fact that all of this is made in India and for the Indian scenarios. When we went to Bhutan, we changed it to made in subcontinent for the subcontinent scenarios. Still true? Yeah? Cool. Sorry. So, Dr. Ramesh is looking at us and I'm trying to go back. Right, so BCLS, we talked about it. Now the difference of BCLS from any other basic life support course, again it is heavily Indianized. So it has more than just CPR and choking, which is traditionally what BLS is all about. We cover 10 common emergencies. So these are from COVID, which is infectious component, to snake bite, heart attack to seizure, hypoglycemia to stroke, how to apply a tourniquet, because 40% deaths on Indian roads can be prevented if only somebody put a tourniquet around that bleeding limb. You've heard of Harish? Or is it Harsha? Harish. The famous case where somebody was bleeding out of their femoral artery, continuously pleading people to help, too many live videos, not enough help, and the poor man died. So, unfortunately, even 5 years after that incident, still there are any number of people dying on our roads on a daily basis because people don't know how to give that simple first aid of a tourniquet. So that is also included. And in India, we are all Arnab Goswamis, right? The nation needs to know. What have you got to say? Let me go live. We are very good at talking things which are not important and pretty poor at doing things which are really important. So how do you become a leader in that kind of a scenario? Local leaders will be there, gundas will be there, people who want to do Facebook Live will be there. How do you take up control of the situation and lead the movement towards saving a life in the middle of all that chaos? How do you manage traffic? So all those skills, communication, leadership and team skills, are also taught in that program. So we've talked a lot about stuff which happened during COVID. So as COVID was coming down, we've got a new very dynamic surgeon called Dr. Ramesh as our Vice Chancellor. So Sir is also very supportive of the JeevaRaksha project. He has been thankfully the registrar of the university at some point in time. He was also a stand-in Vice Chancellor. So he's aware of what this project is all about and he is 100% behind us, which is a great blessing. There is a JeevaRaksha learning management system coming out very soon. It was supposed to come out on 12th of September, but the testing couldn't be conducted because of poor connectivity in the country of Bhutan. So we're trying to roll it out in Bhutan first, but some things called VPN, LAN and other technological things got in the way. So the testing will be completed shortly in the next 2 to 3 weeks and we should have the learning management system coming out. What are the advantages? You get your certificate as soon as you finish your course. If you're an instructor, you get an attendance certificate as soon as you finish your course. There will be a portfolio building up in the LMS for the instructors to show exactly how many courses you've taught, what are the dates, all the certificates attached. You get specific feedback about your performance from the students and your peers flowing into your portfolio page. So you can actually assess yourself and improve. If you're consistently ranked below 3 out of 5 stars by students, you will get a message saying please come and do a refresher course because you're not keeping up to the standards expected of a JeevaRaksha instructor. I'm talking for all programs, not just one or two. Okay? The pre-test, post-test surveys, everything is automated. And the thing that most of our students dislike the most, after every session there is a link for feedback. Theory feedback, practical feedback, feedback of a feedback, backstopping of a feedback. You know, there are too many, right? They've been simplified. These are all now made into 3 to 4 questions with just click, 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 done. And the instructor's name, the topic name, everything is preloaded. All of this is going to be working from your Android or Apple phone. So you should be breathing a lot more easy as candidates if there are any interns here or nursing students here or physiotherapy students. And instructors also will find this experience a lot easier to deal with compared to the previous versions. This is 5 years of access, and all your learning updates will be there. You also have access to your course page for 5 years. So you can go back at any time and refresh yourself. I would like to congratulate Dr. Kishan Rao for agreeing to take up the ECLS zonal coordinator's role in Mangalore region. Since Dr. Kishan took over, Kishan's strengths are he's a people's man. Anybody heard of White Army? It's got nothing to do with Ku Klux Klan. Don't look at me like that. It's not one of those. It's the army of people wearing the white coat. So as a medical student in Bangalore Medical College and Research Center, he realized that good cases, when they come up, if all of us could get some notification to go and see it and do it in an organized way, it is better for the students, the patients and the teachers. From there he started a little WhatsApp group and it became a big movement, now rolling into more than 100,000 subscribers in YouTube as a channel with hundreds of very high quality clinical education videos with people subscribing from Australia, from Africa, from US, Europe, you name it. Not just among Indian origin students. You should just go into the comments box there. It's actually, it makes you very proud as an Indian, that an Indian kid from Bangalore Medical College, and he's from Ballal originally, who came from a very poor background and sort of worked his way up, has achieved this at such a young age. So, we're very glad that Kishan has joined the team because he also wants to make a difference on the ground. And since he joined, you might have seen a lot of newspapers are covering the programs that are being run in Mangalore zone, whether it is Home Guards training or Mangala Nursing College training or any other institution. So he's from AJ, he's faculty in AJ, so please utilize him, and if you need any community training or any coordination between institutions in Mangalore zone. So Mangalore zone is Dakshina Kannada and part of Kodagu, etc. So it's a large number of institutions coming under a small geographical area. Kishan is going to be overseeing that. There is something called Rasa project. I'll come to that in a minute. Bhutan happened. Bhutan heard of JeevaRaksha through word of mouth. We heard from somebody that there is this organization who do good quality training. 8 months they grilled us over multiple online interviews during the COVID time. Different specialists coming without warning and then suddenly asking questions. Okay, in neonatal resuscitation, what you do as the 4th step? In PPH, what's the role of condom? Okay, so different subjects, different questions, grilling over 8 months, and then finally they came and said, Doctor, we have to tell you something. I thought, okay, another question is coming. You're better than AJ. We want you to come over to our country and teach our students. So that was the journey of Bhutan. A significant number of trainers from Mangalore zone helped us in the program. Without them, we couldn't have conducted it. So we've got Sarath, Bhatt, Jimsi, and Gayatri madam nonetheless, all came from here, and one legendary Narayana Holla. How many of you know Narayana Holla? It's a man to reckon with. You should meet him at some point. 71-year-old emeritus professor in community medicine, working for Sulya Medical College, and he was an absolute model trainer, inspiring everyone and anyone who he came in touch with, despite his age and all other things that one would attribute because of advanced age. He was an amazing instructor. So we've had a good input from this zone in making Bhutan successful, and they've invited us back to train in the nursing course as well as in disaster management and expanding their network. So anyone who's training across institutions, contributing to society, if you are instructors of JeevaRaksha like that, we are looking for you. Don't tell me that I teach only in my institution and take me to Bhutan. Okay? You have to be contributing to the wider community, to courses which make a difference on the ground amongst the community too. Right, so another good news, Kanachur and Sulya, two institutions, have also done their training of trainer programs and got accredited as JeevaRaksha training institutes. Again, that makes Mangalore zone a very small zone with the highest number of accredited institutions now. So very proud of the good work you're doing here. Emergency nursing and life support TOTs are in full swing. So in the next year or so, we should have a significant number of nurse trainers, and we will be conducting programs across the state in nursing. State Institute of Health and Family Welfare, Bangalore, the government has come forward and requested for training for master trainers amongst PHC, doctor and nurse training. So we've had roughly 35 candidates from both groups trained, and the beauty of that training is these are people who are isolated in their little silos, very limited resources, very little incentives, very little good feedback. Always people complain about our healthcare system, but these individuals have come, got trained, gone back, and on their own interest started training ASHA workers. They've bought ambo bags for the first time in their little institutions, and they're proudly displaying the good work they're doing. So it is very unfair to judge any group of people in a wrong way. There are excellent individuals amongst all parts of our healthcare infrastructure, community, network, and our State Institute of Health and Family Welfare team demonstrated that beautifully over the last 3 months when the training had happened. Ministry of Health and Family Welfare of Karnataka has called us and requested triage and trauma training for doctors and nurses. So there is a movement from Karnataka government to improve triage and trauma care in all the government hospitals. Okay, so that has happened, and everything is aligning perfectly. I'll tell you why in the RASTA slides. So RASTA stands for Rapid Response, Assessment, Stabilization and Safe Transport in Highway Accidents. Originally we had it as Raksha, Karnataka Highway Accidents. Then we thought most of our projects are going international, national, global. It has to mean something for the whole country. So we took Karnataka to the side and brought the RASTA acronym. Now, currently we are collaborating with Rajiv Gandhi University of Health Sciences, Government of Karnataka, and we would like to very shortly get in touch with the Ministry of Road Transport and Health after the first programs in Karnataka rolls out. So what is RASTA? Why are we doing it? Absolutely to save lives on the roads, reduce disability. We are the leaders in the world in road traffic collisions and deaths. Okay, so not a good rank to have. There is hardly any collaboration between different authorities who are dealing with accidents. No phone calls come to any of our hospitals saying that 2 or 3 critically unwell trauma victims are coming your way. Ambulances don't talk to hospitals, police don't talk to hospitals, and we know when they are here. By then their blood pressure is crashed, they bled out 2 liters of blood, and we haven't informed our surgeons, anesthetists, theatres, CT scan, nothing. All that time we waste to get care to the patient is ticking away during the golden hour. And this is time we could have utilized to save those lives. And no wonder, given such a chaotic environment exists, the death rate is quite high. So receiving hospitals will be trained as a multidisciplinary team, nurse and doctor training in the trauma care and life support course to improve their ability to deal with trauma patients. We want to create 5 skilled first responders in every 3 kilometers of Karnataka highways to start with. And once the first 2 clusters are out, we'll use the data to go and approach the central government to see if they also want to take this up as a project. The people who are trained at the highway roadside pre-hospital guys will be getting a trauma version of BCLS. We want to train all KSRTC drivers and conductors, and we want to improve accident response using the JeevaRaksha app. So I talked to you about JeevaRaksha app. These are the kind of screenshots taken from the app. You get a message like that, multi-car pilot at Tumkuru, you click submitting. When somebody submits for that, we will get the exact location of the accident. Not just Tumkuru, whole district. Which part of the highway, where, and what is the travel distance to that place, what is the satellite navigation to that place. We can make video call to the person who put the message in, and we've also got the ability to alert the authorities to come and support in a program like that. Okay, so journey so far, just a quick summary. The dream started in 2013 because a problem was identified. Solution was suggested as Indian-made comprehensive emergency care courses. First instructor course in 2014, trust was registered in 2019. RGUHS made it mandatory in 2019, which made the biggest difference. Till then, it was somebody doing something, looks good, sounds good, but I am too busy. Okay. When it became mandatory, people started taking more interest. BCLS and EMLS courses accredited in 2019 and 20 respectively, and these three approved in 2022. What are the current numbers? Active ECLS instructors are 835. What do I mean by active? Do you do Surya Namaskar every day? What is active? People who have taught at least 2 courses in the last year. Actual number is around 1,500, the number of instructors, but currently people who are teaching actively are only 835. You've got EMLS instructors 124, BCLS 287, but BCLS can be taught by this group as well. Okay? And your providers, our ECLS providers, congratulations to all of you who are doing the hard work, has just crossed 5,000 last month. So now we are at 5102. This is a cue to clap if anybody wanted to clap. Right. EMLS is 433, and we had a big bump in our BCLS providers number. You can see that it is 32,104 because the district of Chitradurga did a program for 28,000 providers, and this was mainly driven by the 249 instructors from JeevaRaksha. So we had a big number up in the BCLS. So just to mention also, in the last 3 years, we've signed MOUs with 6 other universities other than RGUHS. For example, we got NITTE representatives sitting here. They found that this program was useful, signed an MOU and trained all the interns in the program. And it has helped in everything including COVID management, because the kids knew when to pick out a critically unwell patient and how to stabilize them. And now we have all these countries as the countries covered. More have requested. Nepal, Pakistan, Sri Lanka, Bangladesh have requested. Pakistan has said please come to Dubai and train us because of visa issues. But the interest of saving lives is there, and we don't believe that a Pakistani life is in any way inferior to an Indian life. Saving lives is a knowledge that should be shared across borders. Okay, so this picture you can see 3 from Mangalore, right? In a place called Punakha, with the local children, all embracing the concept of JeevaRaksha, the principle of JeevaRaksha. So that is me. Sorry for taking a little bit more time than what was advertised. I hope you got a quick overview of what is happening. Any questions at all? Thank you so much.
So this is one of the feedback we have just received in our ECLS, since most of them have left from our institution, those who have finished ECLS. So it's been a gap of around 3 months now. So we have just few feedbacks for our students. This is one student we have from Subaya Medical College who had come here and did ECLS. So just to present.
Hello everyone, I'm very happy to be a part and parcel of this ECLS course, especially because I'm from Subaya Medical College. In our hospital, this ECLS course is not being started, and I heard this AJ Institute is conducting, and with a lot of questions we approached here, and we got a good mentor, Dr. Sarath sir. Whenever, anytime we call him, he approached in a good way. He contacted me back. He promised this course will be like a memorable one in your life. So we 3 came here. what are the expectations we kept here. More than that, it's like mind-blowing experiences we got, and we finished our internship. And because of this COVID time, our medicine posting was of 4 months. I'm telling you right now, if I'm getting posted in medicine or any emergency case or in any casualty, I'm damn sure that I can do much more better what I have carried messages from this course. So thank you so much for this course being conducted. This won't happen because JeevaRaksha sir being a great pillar for this and having a good organization and good mentors here, good teachers, very friendly. Personally speaking, I haven't seen such a like friendly, casual. Like by feeling only, we feel like go and approach the teachers, speak to them, talk to them. I haven't seen any of the colleges, and I'm very happy to be being experienced from this college. And 4 days was really saturating, but still I'm telling if we are mugging up this, anyone can become a doctor who can be like mugging up capacity, memory, can write tests, vomiting, anything. They can become a doctor, but an ideal doctor will only become possible if you feel the patient and go back down to earth, experiencing. Because if you know nothing, you will be there. If you are having only moderate knowledge in this profession, you will be thrown out for sure. Either you should know completely perfect or you should not, you should keep quiet. So from this course, definitely instead of bits and that, we are trained for 100% only. I'm very thankful for that. From this course, I can assure that I have achieved a lot and I have gained a lot of knowledge. So definitely I will tell my friends to join in this course. Even though it is 4, it is very worthy. Thank you so much. Thank you everyone.
Good afternoon everyone. Basically this course has mentally prepared me, and I'm sure every one of you all in some way that at any point of time we'll be able to face any kind of situation that will be put to us. It was definitely fun, and we had this amazing set of teachers, and everyone helped, and you know, everybody's voices were heard. So, and it really brought out a real life situation, and it was really good experience with nice food. So thank you. Thank you, Dr. Preetiraj. Okay.
So we are very grateful to her also. She gave a very good feedback to us, and it motivated others. This wasn't the first batch as such, so it motivated other interns as such. And the moment we give up the Google form, within almost like 10-15 minutes, all the candidates will be filled in. So that is the impact. The course as such, the JeevaRaksha, what we have this here, the emergency care life support. So how they have distilled it and they have provided us this particular course for all the institutions, and also the way they teach and they train our instructors. So that's more important as such. So the moment we do our first, second, third training as a faculty, when we go and teach in other theory classes, maybe for regular classes, the things will change. A lot of improvement was seen, and our even faculty were giving us the feedbacks. How even Dr. Sudheer was telling how there is a change from the previous teacher into a new teacher. So thank you. She is Adrija from Subaya Medical College. Now almost this presentation, what we did in AJ is like almost a Thanksgiving presentation would be. Already the module, teaching module what JeevaRaksha has, and we also share the vision of JeevaRaksha as such, so saving lives and assuring care. exactly 1 year, 9 months back. So the inception of AJ Skill and Simulation Center that was inaugurated by Dr. Rajendra KV, who was the Deputy Commissioner of Mangalore. So this state-of-the-art AJ Skill and Simulation Center, so our management has given us for all the courses under Lakshmi Memorial Education Trust, and we go in parallel. We started just 1 year, 9 months work for the regular classes for 5 of 6 institutions under LMET. Then we had the American Heart Association courses. Along with that, we had JeevaRaksha, RGUHS, comprehensive emergency care life support, and also basic care and life support along with ECLS. So this we can see in front of our administrative block there. So this is the JeevaRaksha what we had. So Dr. Ram sir has given an idea. So all right, sir is sharing Vijay Bhaskar Reddy sir's idea also. So that was the best thing happened in the beginning of the course itself. So you can see it there. And these are the bunch of trainers from AJ. Then we had from Kanachur, Srinivasa Medical College, and even Father Muller's, K Medical College, and many of our Mangalore institutions. So for AJ, 15 of us are trained, and as Amar mentioned, the beautiful and also intelligent. So we have those instructors here. The first interns rollout, that was the TOT, training of teachers we had from March 2nd to March 6th. So in 2021. So after that we started with first interns rollout. Ideally our interns, many of them were out, the fresh batch had come, they were only around 30 plus. So in the beginning it was a bit difficult to convince them coming out from internship and getting into the course paid by them, and for that our Ram sir and Vijay sir, many of them were in regular touch, and they gave us the idea how you can go about, how you can convince students as such. So that was the only time we convinced them. Later on they started convincing us, sir please put us in this batch. So that was the transition. Soon after the first batch of 20 people, we just had 20 that particular time, and few of them had come from outside. So transition was there. That is mainly because of the content of the course and the delivery of the course and the way TOTs are conducted and faculty are trained and the way faculty are giving them themselves. And people are like, it's not, they are not paid in our institution or like as such our instructors. So we can see many of them here. We have Dr. Smriti, head of the Department of Physiology. We have, please don't mind, please, please if you can come here. Dr. Smriti, please come. So we have Dr. Aswathy, Department of Pediatrics. Now she is the course coordinator for ECLS. So she's taking in charge and doing it beautifully. So then we have Akanksha, maybe just left. And we have Dr. Prabhu. Please come. The Department of Anatomy. He is also the coordinator. He is one of the backbone of this particular course and AJ Skill and Simulation Center. Yes, Dr. Robin from my department. Yes, and along with this, we have many of the. This is the like Dr. Ryan is there from the Department of Surgery. We have Preetam from the. She's here from Anesthesiology Department, and we had Dr. Neela from Department of Psychiatry, Pooja from Department of Radiology, and Prajna from Microbiology, Sanchita from Microbiology, and Chaitra from OBG, Nishita from OBG. So they have done a wonderful job, like whenever they were assigned with these And it is like they were happy. Most of the times Dr. Smriti used to tell, Sharad, when is the next ECLS? Because this bunch of instructors, they are not only into this content delivery of whatever JeevaRaksha has given, they were feeling that ambience was so good, we started enjoying it. So that was the change what we had from first to the last. So in the beginning, maybe people haven't, they would have pushed for getting into this. Later on, it became a regular routine for us. So module as such, we believed in the first traditional module. So theory, demonstration, practice, debriefing, what went on well and what to be improved. So this we believed, and most of them trust the same, and we didn't ask JeevaRaksha people to go with LMS or any hybrid models because we enjoyed it. And every course we did the inauguration and we did the valedictory just because let all the students feel that we can skip. As you know, JeevaRaksha, they don't go with this political whatever the inauguration or something. We started the program before the inauguration was done. So this happens all the time, and that is what JeevaRaksha is. We know that, and definitely we give much more importance for the learning, and the interns when they go out from here, that satisfaction would be there, as Dr. Sarath also said here. So that is the emphasis. That's what JeevaRaksha emphasizes, and we also believe in it. Then the second interns rollout, Dr. Pradeep Senapati, I missed the name, Dr. Pradeep Senapati, this was the COVID times when we did, and he was the able person who could handle that particular code batch of ECLS. And indeed we had a COVID patient also as such, and she was inducted in the next course. So maybe first day itself, we could recognize it. So it was a difficult times for everybody, and we didn't want to give up that. We tried with, again, it was the 20 students with all the social norms, distancing, all the precautions what we had taken for the COVID, ongoing COVID pandemic. So next batches, we had Smriti as the course coordinator, as fun-loving and students' favorite. So it was very easy going for us. And next in October again we did it. So these are just, I'll just show the picture because it may not take much of time. So all these, Dr. Sudheer, you can see here, he had come as an observer. The best thing of again these courses are, it is not only you are doing, the quality, JeevaRaksha makes sure that the quality of whatever we are doing consistently remains the same. So consistency, quality, uniformity, all these things is taken care of. For that we have the observers coming here regularly. So Saurabh was also there previously. We had our Gayatri ma'am who had come as observer. Then many of us from various institutes had come here. So we know that it is like it is just the interns rollout. Seven of the batches we have finished, and the BCLS which has started, baby steps. Now refining every time. We have a checklist of every time the course director comes in here. So we give the checklist to go with the permission. Starts with the permission of the vice president until the closeout, and the course director signs and sends the acknowledgement to the JeevaRaksha. So until then, we have the checklist around 60 to 100 tasks to be done. It's not one or two. It's not as simple as such. Even the documentation, it grew gradually from the day one until today. Now, so sitting at Bhutan, Dr. Yogesh is sending the forms here, and we are just filling up there, and one data person is enough to just, now it is made very, very easy as such. So that is the improvement even JeevaRaksha is also giving us. They are updating it every day, I can say. So we have Dr. Vijay Bhaskar Reddy sitting either in Ballal or USA. So even in flight, he would be making sure that things go well, and every opinion from each and every faculty will be taken in, and it will be discussed. Only after evidence we get it, because we have to go with evidence-based medicine as such everywhere. So after the evidence, they've just updated. And few things like head control, The manual inline stabilization holding the shoulder became head when I went this time also. So it is like updating as a lifelong learning as such, as we have in CBME, competency-based medical education. So every doctor is a lifelong learner as such. That's what we give for Indian medical graduate. So that's being done and everything is taken care here. So our instructors are very happy about it. So even after intense rollout of Tamil, we had the new batch coming up, and we'll be doing it next month, this ECLS. And as I said, I promised Thanksgiving. So our management, very supportive. From the day one, every equipment, sometimes the previous night we have got everything which were like we had missed it. So same way, that is mainly because of the vision of the director, the president. We have Dr. AJ Shetty sir, and also Shri Prashant Shetty sir, who is the vice president. So then we have our backbone being, you have seen Dr. Francis and Dr. Sushil. So we have Dr. Ashok Hegde sir, who is like, who used to come. They have come to every ECLS session for that inauguration. And also one of them for the valedictory function, for giving certificates, making sure that this has the impact, and the administration at the higher hierarchy, they know what's going on here, and they also are overseeing whatever is happening here. So after that, instructors and the ages scale, and like all the time we mention it, JeevaRaksha people, we have only Ram sir and Vijay Bhaskar Reddy sir. We know that they are tremendously, they are working hard and making sure everything goes on fine. And we have many other people there in the JeevaRaksha office also. So many of the times we look into the Facebook or the, we haven't seen them, but we have interacted with them. So they make sure that things go on well. So that is the teamwork which is going on there, and here also it is the teamwork which is very important. Now, when we are getting into BCLS and ENLS, so that is we need. That's what we need here. So we shall do it well. So we shall, anyway we have started with BCLS, ENLS also, nursing also, we shall proceed with as soon as possible, maybe before the end of this particular year. So, so thanks to everybody, that's what I can say. So as it is given, the woods are lovely, dark and deep, but I have promises, we have promises to keep, and mine to go before we sleep, and all of us. So the instructors on behalf of that, and mine to go before we sleep. So sorry for modification. So thank you. Let's go with question and answer if any doubts. Nothing, it was like no contents or subjects were presented, I know that, but still, any doubts in case, we have our allied science people and the nursing staff. So we can clear out. We have our CEO sir also here, we have senior instructors, so we can clarify things.
The AC is too cold.
And congratulations to our new team member, Dr. Kishan. So we are very happy that now it would be still more easier for us to communicate also. So Kishan is from our own, my badminton partner too. So, so that's a good thing, and we will definitely do well in coming years.
Thank you very much. For the wonderful speech, I request Sudheer sir to give him a beautiful bunch of flowers. Let him give a JeevaRaksha. Which one you can select, sir? Your favorite. JeevaRaksha being awarded to JeevaRaksha. Now we have almost, see, so far we have talked about only the good things, whatever we are doing, everything, we are boosting ourselves. Now it's a high time to introspect ourselves. So many instructors are here. It's a high time to introspect ourselves and realize the importance of what we are doing, and most importantly, how can we do it better. being instructors, you have been in the field training the students. You have might have faced many problems, practical obstacles, many technical glitches. So now it's high time to bring it forward and also along with the solutions. So we have for this panel discussion, JeevaRaksha way forward. We have panelists from represented the different institutions, the course in charges there. From Kshema, we have Dr. Gayatri Bhatt as a panelist. Please. Will proceed on the aspects. Please. And we have Dr. Nicole Pereira from Ballal Medical College. Welcome to you, madam. And we have our own Dr. Aswathy, course in charge at AJIMS of Medical Sciences. We have Dr. Preetiraj Ballal, representing KVGMCH of Medical Sciences, India. Welcome to you, sir. And as any other institutes representatives? So as a moderator, we have our own K Nair, sir. Thank you. So first I would like to request the panelists to put forward your views and your experience briefly, and also if possible please give us the solutions for the problems what we are facing, and then it will be summed up by the moderator. Thank you. Nicole.
So a very good evening to everyone here, and good evening to the moderator and to my co-panelists. A few days ago, Dr. Sudheer called me up and said, would you like to be a part of this panel discussion on, drawbacks with regards to ECLS training in India? And then I thought for a moment and I said, okay, I'll take it up. And then I had a few questions, and the first question I did was ask myself, what are the challenges we face as an institution in Mangalore in training individuals for emergency life-supporting care? So the first thing was, we have a wonderful institution, we have a wonderful set of trainers that we train regularly on, in probably 4 times, 5 times in a year. We have wonderful success stories. We have highly motivated staff that run these programs, and we have a wonderful champion. And why I use the word champion is because they've mentored all of us to be what we are today and instill the knowledge. So the question was, how can we sustain? How can we sustain and how can we improve something that we've already achieved, and how can we continue doing this? So, as you see, when we conduct JeevaRaksha courses, at the end of every program, we have a day, a moment in a day where we actually look back and we conduct a debriefing session. We look at things that went well, things that we can improve on. So, so in that context, we have so much of information, so much of knowledge about things at places where we've improved on and where we have improved. And so we have a document. In fact, it's not just a document. In fact, it's a living document. Just like how Dr. Sarath mentioned, we have Dr. Vijay Bhaskar Reddy, who's sitting in America, traveling on the aircraft, looking at all this information and correcting it and improving the information that we are going to utilize to train our students. So one thing is, that is a method of sustaining, ECLS and improving it. Another thing that we utilize for sustenance of this program is, number one, we need faculty who are highly motivated. And that is something that I feel is one of the biggest challenges. You know, we have a burnout of faculty. I've observed faculty gets burnt out at the end. And so one thing, so that's one of the biggest challenges, burnout of faculty. But in spite of that, Dr. Sarath just mentioned to us, you know, a person should be highly intrinsically motivated to actually do what he wants to do, you know, to teach, to identify a lacunae. Say, for example, in the PHCs, we have lack of, you know, skilled interns who can actually manage these emergency scenarios. We have lack of this. So, for a faculty to understand the lacunae and for the faculty to do something about it and to get trained, to become a provider, to become an instructor, is one of the biggest challenges to continue, you know, that. And the other is extrinsic motivation. So he said that his faculty are not getting paid. So that is one of the biggest, you know, challenges. But I would love to say that, you know, our institution, headed by the champion, the dynamic Dr. Lulu, has made sure that, you know, we are, we are able to run this, you know, course, and we also have extrinsic motivation that helps us to do what we, you know, can do and provide to the society and eventually to healthcare. So I think, you know, these are a couple of challenges that we face with regards to, you know, sustaining the ECLS course. Other than that, you know, to bring a sense of unity, you know, a sense of unified, to be a JeevaRaksha, as Sir was, you know, saying earlier. Not everyone feels like that, you know. There are some that do and some that don't. So, you know, to have that unified feeling of being a JeevaRaksha, holding on that, you know, that baton and, you know, carrying it on, so that, you know, instructors continue what they're doing and will provide, you know, knowledge, skills to the students so that they can perform better and can save, you know, the patients and you know, society as a whole. So I feel these are a couple of challenges that we face. Also, in addition to that, research is something that you know, we can take forward. We have a lot of information. We can utilize that information and, you know, kind of like utilize it and therefore publish it and things like that. So yeah, so this is what I have to say.
What are the solutions?
So yeah, so as I said earlier, what we are doing is you know, number one, faculty burnout. So what we've done is very recently we have incorporated, we've had many other programs where we've gotten in many other new JeevaRakshaks join us, and I'm very proud to say we have very highly motivated set of 25 new faculty. So so that has been the biggest advantage in our institution. In addition to that, we have a very highly you know, intrinsically motivated set of senior instructors, and and seeing success stories of the students, we ourselves get motivated to do what JeevaRaksha has trained us to do. And with regards to you know, getting relieving orders from the departments and things like that is something that we have to constantly probably try to you know, probably discuss with our senior faculty, and you know, for them to know the complexities of what we do and understand what we do, so that it's easier for the senior faculties to give relieving orders to all of us. And research, yes, we have started, but we have a long way to go. I think we're taking baby steps there. So yeah, so these are the solutions to.
Thank you.
Yeah.
So good points. I've got the. So this is a common trend that we see in any project or program where the intensity is high, burnout is also high. So we need to incentivize our instructors in a way that they feel both valued and respected. So a lot of people are putting out their time beyond their teaching hours, many times weekends. We talked about the model where you were doing the online teaching, online mentoring, where a lot of the input from the instructors come out of normal working hours. So one of the suggestions we give to institutions, and some have done it well, for example Shema, Bagalkote and Chitradurga, a few places where they actually pay, even if it is a small amount as a regular honorarium to the instructors, it's a token of respect. They feel like they are being valued, and it is easier for them to come back and do the program time and time again, despite problems with the rota, problems with departments, and all the other responsibilities they have. Second, you already touched upon it. It's a question of building a family. This is not a business, and I'm sure those who are witnessing this panel discussion online also would agree. We got institutions like Oxford, which trained hundreds of interns with just 7 to 8 instructors. The same was the case in the Ballal Medical College near Bidadi. We had FMMC Bagalkote, which took up the training long before it was mandatory. So this was pre-2019. They were ensuring that all the interns were trained. They got into nurses training even before the ENLS was introduced. So they made sure that the nurses were trained in a one-day program. They trained the fire service and the police staff from their district. So branching out into beyond the walls of the college. NITTE has started something called Abad Bandhu. Again, influenced and inspired by what we do in JeevaRaksha. They started training healthcare workers as well as ASHA workers and even citizen volunteers in tackling the neonatal and maternal mortality in the community, teaching the small and the simple things so that communities themselves can come forward and cut down on emergencies and deaths related to emergency. So this is one thing, having that positive feedback, having that sense of we are doing something, we are achieving something. Those who came to Bhutan with our team would agree that seeing the smiles on those instructors' faces, hearing their feedback, the little presents they gave, madam has received some magic and fancy mushrooms from high up in Himalayas. Please don't try it without medical supervision around you. But the fact that the gratitude, the thanksgiving that comes from each one of the instructors and the students that we teach keeps building upon that self-esteem. Institutions, like Sarath just mentioned, it's not just enough that the senior management is present before and after every program, but the management should facilitate the release of instructors. Father Mullahs does an excellent job because the departments are told. So the coordinator doesn't have to beg the departments. Coordinator doesn't have to go begging every time to the dean. So it should become part of the structure of every medical college's management that the staff are facilitated to come and teach. Coordinator's role should be only to coordinate what is happening within the 4 walls of the skills lab. You add a little incentive of out-driving to it. And the other thing that came out, this works in 3 ways. There are functions like road safety bikeathons, training the railway staff for disaster management, cardiac arrest, cardiac resuscitation, information sessions we do for larger public. There is Aero India happening in Bangalore every 2 years. So functions like this which combine instructors from all around different institutions. If you go together as a JeevaRaksha family, if you look at Bhutan, that's what happened. 16 people from 8 different institutions across the state of Karnataka, 1 from Bhilai. So all these came together and went as JeevaRaksha. So if we can combine together and go as JeevaRaksha and do a good job, that also improves and increases the spirit of a sense of family. So I would like to plug our road safety bikeathon, which is happening from 18th of November. It is getting flagged off on 18th of November from the front of Vidhan Sauda in Bangalore. Those who are on this side of the mountains, I'm talking about the west coast, you can join us on the 19th by coming through Sulya. Dr. Bhatt is arranging breakfast for all of you. Coordinate with him and let him know how many are going. And from Sulya, you're coming to Virajpet. You can come in 2-wheelers or 4-wheelers. Just make sure that you're wearing the helmets and seatbelts. Because the message given to the community is helmets save lives, and in big numbers. We're talking about 80% of head injuries in our roads can be reduced if helmets are worn and buckled. I'm not talking about the frying pan which people wear just to protect themselves from challans from the police. If you kick on it, you will know that the hole goes through. I'm talking about proper helmets. That's one. The European studies have shown that mortality is reduced by 60% on head-on collision if you're wearing a seatbelt. Recently, a very senior businessman who used to be the chairman of Tata company, perished in a very well-equipped foreign German sedan, for example. All the safety features were there. They were going too fast. It was a big collision. The car tumbled over. You know why they died? Didn't wear seatbelt. If you don't wear the seatbelt, all the safety features don't kick in. So it is a simple case of clicking that seatbelt in, it saves lives. So it is an important message. And as organizations who are leading healthcare in regions around our home, you all should come together, get your students interested, and come out as a family and print t-shirts. JeevaRaksha Mangalore zone. Don't go institutionalized. The biggest risk is people are always plugging institutions. Go beyond institutions. We've just gone beyond borders. The pleasure you get while you branch out and look at every single life, every single incident as a global incident to save a human life, it improves the positivity amongst the crowd. Another thing SNMC Ballal did, I don't know how many of them are listening to this right now, and I'm talking 2017-2018 period, where they had roughly about 40 instructors from different specialties. They used to have a get-together once a month. They'll do something related to emergency care education. Then they'll go out for a meal or a picnic together. So the other faculty in other departments who are not part of JeevaRaksha felt really jealous. We want to be in that club. So being the club that does the good things, being the club that saves lives, how much ever stress you have, however late you're staying back to teach your students, when you're out there, smile about JeevaRaksha. Stop complaining about the hard work. That also helps. It's a messaging that we put out. It's the faces that we show. I've just attended a conference in Father Muller's, India's first ever, as I said, the medical skills and simulation conference. The way the team reacted made the conference. So the way JeevaRaksha family reacts will make us as a brand which is what people would aspire to. So I hope we have answered that part. Research, you guys have inspired us. Just attending the conference and looking at different aspects of modern education principles, we were thrilled and disappointed at the same time. We were thrilled because most of the things that we do in the skills workshop of JeevaRaksha are only theory and philosophies in the minds of the educationists. So we are already practicing things that they would like to embed in different institutions and colleges. So why are we not writing that up? So while we were following the panel, I was just sitting there and muttering to Dr. Sudheer, who's interested in research, that there's a lot of work coming your way. Different institutions should write up about what they've done. Sulya trained close to 250 interns from 2 batches over a period of 2 months with just 12 to 16 instructors. Tremendous amount of work, and the quality didn't slip. How did that happen? The world would like to know. The nation needs to know. So, writing about your experience of what you achieved and how you achieved it will make a big difference to how you push your brand as an institution, as a group of lifesavers. And there is a lot of opportunities for research. Anyone interested, please get in touch with us. We can give you the work and we can support you through publications. Thank you so much.
Yeah, good evening, sir. I think only doctors are remaining.
Actually, beyond that camera, there are hundreds of thousands of other people watching live. We are visible to them. Yeah.
So this panel discussion is to discuss about what problems we had. Yeah. So actually, it helped us a lot. We started with 25 instructors. And it's not only in the JeevaRaksha ECLS program, otherwise also it was helpful for them to conduct the CVME skills. We got hands-on demo how to do that. It was exactly the same time when the CVME became compulsory. So it helped us a lot. So it was like 2 things in one go. So we're very happy about that. A lot of appreciation for the way we took over. A little bit of hitch what we had is because burnout or attrition, like many people had to go relocate themselves. So our instructors' strength came down, and we trained another set, 15 to 20 people. There was a little bit of, to say, we are already seniors, they are juniors, so put them more in the instructors were feeling, I have already finished 1 year and I have more experience. Now these people are just trained, so take them more in the ECLS program. Leave us alone a little bit. That kind of a feeling was there. So I felt that JeevaRaksha has to do something about these, as you mentioned here, active instructors. So we need to have a transparency record where each instructor will be given a number or ID, and per year how many you have done, it will be shown there. So either the institution pays or some other MOU what you have, little bit of transparency in that, so that it gives them a motivation. See, I am already 4 years I have done, and I have done 35 ECLS. I have trained these many. So this is an era where you have to boast about yourself, or you have to tell about whatever you say and do. There is a satisfaction, everything, but it has to reflect on your career in the CV. For the, maybe not for us, but people who are continuing in the medical colleges, and they have to show that. So little bit of that work has to be done through the Central Committee of JeevaRaksha.
Thank you, it's a very good suggestion, and already it is embedded into the LMS system. So your portfolios are going to reflect that, and you can make an easy printout of it for your appraisals. We are also talking to the university, like many of you might be familiar with something called RATI, Rajiv Gandhi Administrative and Training Institute. Getting a RATI qualification helps you with career progression. We are linking that. We are looking at linking JeevaRaksha training and significant number of years put in for JeevaRaksha also to link up with how you can progress into different positions. And the proposal has already been given to RGUHS. So hoping that something solid will come back from there. So the documentation, demonstration of who are active instructors and who is not, because of COVID we had suspended it. We're starting some refresher courses across the state for those who have not been training over the last 3 years to get back into the stream. And once those are completed, those who are not teaching minimum 2 courses per year will become inactive, and they won't be allowed to teach without attending at least a step 2 under supervision. So that is all.
Thank you.
Thank you so much.
Good evening, one and all. Very quickly, I'll just few things which we have been facing over the past 7 rollouts. One is definitely, like both of ma'ams have said, instructor burnout. A lot of people have left, and here what we have tried to do to prevent this burnout, because what we see is the first course which we conduct will always be enthusiastically conducted, and as it will be, you know, every month then or every 15 days we'll have a course and we're calling the same set of people, and it gets little repetitive and it gets very tiring. What we thought about it, even last debrief, we all had just sat together and thought that a few, at least 1 or 2 instructors can be spared for the next one and call them for the alternate so that we have a break. This is other than conducting another TOT. So at least for the next 2 we can spare them, they can do their department, many of them. I'm sure our institute actually facilitates a lot. They allow all of us to come from our department to take the course here. However, still it is difficult for many to leave and come, especially the clinical side, it's very difficult for them to leave and come. So this is what we thought, maybe we can spare a few instructors and call them every alternate day, that is one. And we are working on the incentive, that would be a good, incentive for calling everyone, because that's what we thought of for the past 2 times, that incentive would really push for, you know, all our instructors to come every time. Not, you know, it's little. However, our team is so supportive because we are coming and staying all 4 days. All the instructors come all the 4-5 days, including the the day 0 also. Everybody will be here till 5 with the debrief. you know, just because we have actually found a very good bond, and that really helps for us to come. Our AJ family, we are really close, just like we work like a family, always looking out for each other. So that has really helped, and that is the reason why we keep coming again and again to see our team. And also, I feel this is a very wanted step in the right direction, because our future of our medical education is simulation. And many of the staff members are very resistant because they don't know what this is, what it holds, and what, because especially a lot of people in my department, I'm saying, is they don't want to get into this because they did not touch the mannequins, they don't know anything about it, you know, so they don't want to come, they don't want to you know, take that first step, because okay, fine, others are doing, but I don't want to get into this. So, but I feel this, people who are trained under this, that fear goes off of, you know, of the simulation.
And it is so easy to teach.
Yeah, it is easy to teach, and this is the way forward, and they need it. The students also, they require this as part of course, CBME, and otherwise also when there is, you know, these patients are actually dwindling and that hands-on training is reducing. This simulation comes into picture for a lot of things, and especially emergency can be learned beautifully through scenario, especially with the mannequins that we have for high frequency bands. So that's all.
Thank you so much. So again, a very inspiring model how a small number of instructors are working together to create magic. Well done, Sarath and others in the team. One option we have given, if you look at the post-COVID operational guidelines, is for instructors to be called for half a day. So if you are really pressed for work, have a 4-member core team running the course, and others come for half day here and there. So each course doesn't feel like such an onerous task. So that is another way of looking at it and working it. And I know Sarath has already said that we don't want to break the traditional mode, we enjoy it a lot. Maybe, just have a look at the hybrid model, maybe once, to see how the instructors are coping with it. You might find that the pressures are much less in the hybrid model, especially once the LMS on the phone comes out. If you use hybrid model the way Father Mullah's used, you need a lot of coordination. We are using Google Meets, and the team needs to work like in a picture perfect way, with timing also being very specific. But once the app comes, the app will facilitate a lot of that background work already for you. So you can put, when the mentor-mentee meeting is on the app, it will go as a ping to all the candidates. A lot of your physical, clerical work is taken over by the app backend. So it will make it much easier. Maybe give it a go. You know, all of us don't need to keep on breaking our head when some solutions are available, and you might be surprised. Because one thing, the first feedback we got back from Father Mullahs after they tried hybrid model was, students were very happy, but instructors were unhappy. Why? Because a sense of satisfaction didn't come, because they couldn't stand and teach. Which, you know, it tells you two messages. One, our inability to embrace change and explore whether things might work out in a different way. And on the other hand, the enthusiasm of the team of instructors to have that direct input and the direct feedback on a live, on-site training program. So both were good news as far as we were concerned. And thank you for experimenting it and making sure that rest of us also can follow one of the models you've experimented. Thank you so much.
Good evening. So, yes, we also trained 2 batches of interns within a span of 2-3 months in KVGMCH college. Yes, of course, after the first intern batch got over, we are actually a very less number in our as trainers. So we are completely burned out, and a few people also left from that small group. Okay, I don't know, because of this ECLS failure or something else. They left. Okay, so finally new set of
don't build ECLS. They got jobs.
Oh, yes,
some people got government jobs.
Yes, definitely. So when second batch of interns came in, so that was freshers batch. So we made some alternatives. As Sudheer said, we tried your model 3, slight modification from model 3. That is the afternoon session. Instead of 4 days, we made it 8 days, only in the afternoons. But small changes here. We are not completely doing the theory session followed to practicals, but theory along with the practicals. in 8 days. So it actually helped us actually from the clinical side. So we could do our clinical things in the morning to afternoon, we could finish all our things, and afternoon come back and join for this ECLS. It actually helped. Thanks to our co-director, Dr. Bhatt and Dr. Ballal, for this coming up with a brilliant idea.
And that is another thing we want to tell you. Any workable model JeevaRaksha will support. So when this was taken up to us, we just looked at ratios, we looked at timings, and we looked at whether each candidate is getting the maximum skills exposure. That's what we're concerned about. When they walk away from your program, whatever model you're doing, they shouldn't be walking away with just a memory of a model. They should be walking away with the spinal or the muscle memory of how to use the skills to save lives. And tremendous effort by Sudheer as well as Father Mullahs in trying different types of training. I would like to talk about a couple more institutions. One is Chitradurga. So Basaveshwara Medical College Chitradurga. They started off by training their interns. Then soon they realized the value of the program. That they made it mandatory for all their postgraduates. So all the PGs are also getting trained in the program now. They've already got 20 plus instructors, but November they're doing another set of instructor course, including the Dean. He's leading from the front. So their instructor numbers will go up tremendously, that the pressures they have will come down. So that one-off investment in instructor program makes all the difference. You got Hassan, a government college, but fantastic support by Dean and a bunch of senior faculty in making the difference in starting the program even before they've got a skill lab. They are renting skills lab and training all their interns. Same is true about Mandya and Kodagu, two other government institutions who are going beyond their call of duty in ensuring that the interns are trained. So fantastic examples, centers of excellence, different models of working from the JeevaRaksha family. And I'm hoping that more of these kind of programs, if you organize at least once a month, we can share areas of best practice, centers of excellence, and what we can take from there, and we can share some. So for the next one, if we could have one of the centers presenting what is your best practice, like Sudheer did today. He told us 5 models. If you have a best practice, bring it on, show it to the other centers, so that we can all learn from you as a family. So there's again no hierarchy here, whether you have a multi-crore simulation lab with 10,000, 20,000, 30,000 square foot, or you're running your thing in an examination hall with rented equipment. At the end of the day, it's the interns, it's the nursing students or the physiotherapy students or whoever they are who learn the skills and make a difference to someone else. That is the most important part. The heart of the program is the most important part. So if you have any best practices, get in touch with us. We will be highlighting it through the future CMEs. Any final points?
I'd like to add 2 other challenges that I just thought of.
She's thinking of
Just another 2 things that I just thought of. Another big challenge is attrition with regards to skill amongst our students. After they finish their ECLS course, so what happens is these kids get out, they have a duration of 1 year where they are studying for their entrance exams. They forget whatever they have learned. Now that the app has come out, maybe you can have a national, a map where you can identify what are the GR training centers, so that any student anywhere in India can go there, refresh their skills, their knowledge, because as I just mentioned earlier, we're constantly improving ourselves. We're updating information on the websites and on the app now. That has to move from us to the student, and how will that take place? So I think on the app, it would be really good.
Couldn't agree with you more. 2 things. Not just have a list of JR centers who will be willing to train. And interestingly, from yesterday's meetings with different experts, Tamil Nadu government is inviting us to go and train across all 38 districts of Tamil Nadu. So the number of JeevaRaksha accredited centers are going to go through the roof over the next few years, thankfully, because of interested parties. But even if you have a skill lab in your institution, this question was asked by somebody in the conference day before yesterday. You have a skill lab, you've spent 26 to 40 to 50 crores, how much ever. It opens at 9:30 in the morning, it closes at 4:30. We all know our students, our clinicians, our teachers are all busy between the 9:30 and 4:30 time. How do the students benefit from such an expensive, well kitted out facility beyond working hours? So the West has already tried this model. Those who have completed a training program, allow them to log into your skills lab, have 1 or 2 staff here who can keep it open initially to maybe 11 o'clock at night. This is the way libraries have gone, if you think about it. Libraries are centers of education. Originally we all knew, it opens at 10, closes at 3. It is a distant dream. You see library from a distance. And when I was studying medicine in the 1950s, a few books in the shelf which is never accessible to you. Then over a period of time, libraries became more accessible, it became more open, and it became 24/7. So why not Skills Lab as centers of excellence for those who are already signed off on any course to get that access, to let them come and intubate. Your Skills Lab staff working in 2 shifts, maybe one 8 to 4 and the other 4 to 11, will ensure that equipment is not damaged. Kids get an opportunity to refresh their skills. And of course, it's a fantastic idea. Be again borderless when it comes to JeevaRaksha providers anywhere in the country who can just step into Rajshekhar Maitre's lab in Ballal or Nicole Pereira's lab in Mangalore and go and refresh your skills. Fantastic idea. Thank you.
Last question, sir. When are we all going to get our JeevaRaksha t-shirts? That will be a sense of total oneness then.
Yes.
Oneness, as you know, is the feeling of me reaching out to you within me. But it's a good question. We've been trialing t-shirts, to be honest, from last 4 years, trying to look at different designs and models. These things are not cheap. If you want to have a t-shirt which lasts more than 2 years and 20 washes, you're looking at an average of 500 to 600 rupees. So we have looked into it. We spent our own money in trialing different t-shirts. So there are 2 ways of getting t-shirts. One, if you all express as a group back into team@jeevaraksha.org that there is a significant need for t-shirts and we are willing to at least part fund it, we can look at bulk printing t-shirts for all instructors and maybe even providers. It is not just t-shirts but also things like caps, little stickers. I am a proud JeevaRaksha with the hand coming in. The sticker that you can attach to your helmet or your car have also been tried. So we've actually explored this. We would like to take it forward. Funding is an issue, so if any of your mothers or fathers are running big companies or have got CSR funding going, please let us know. Because I answered this question earlier to someone. He was asking, you're wearing a t-shirt, why am I not having it? I said, please come and register for the bike-a-thon. It's not my t-shirt. It is t-shirt given by TVS Motors to those who attended the bike-a-thon. So please come. If you come for events like that, you get that t-shirt. But beyond that, if you have any funding sources, let us know. All the design and all the work to create brand JeevaRaksha is already done. So I need help from all of you. Please let me know. We will go forward with t-shirts. Thank you.
Sir, you can give us the design and print for our
we can, but I don't want it to be institutional. That's it. The whole
No, the institution name won't come. You just give us the design.
Shailaja cutting design is coming to you tonight itself.
Next week we'll get the
Yes, and if anybody wants to buy t-shirts, I will share Shailaja Katti's email and phone number with you. Let's make it a family thing and let's do it. Not a problem. Thank you.
Thank you, sir.
Yes, Kishan. So I think that's the end of panel discussion. We'll hand over to Dr. Kishan. Thank you.
One second. I request Ms. Madhu to hand over a token of our gratitude to all the panelists and moderator. Please. She is an emergency medicine technician.
need to stand with us for the photo. Sarath? The problem is, with the way we have bent it down, can the YouTubers see our
it's visible, it's visible. Your head is not that.